Hello friends, welcome to the series of PNF. Welcome to LJ Institute of Physiotherapy. Let's start with PNF technique. So in last class, we have discussed about the introduction of PNF and basic procedures. We have started with the basic procedure for facilitation. In basic procedure of facilitation, we have discussed about resistance. So mainly we have 10 basic procedures for facilitation, resistance, irradiation, reinforcement, manual contact, body mechanics, verbal, vision, traction, approximation, stretch, timing and patterns. So let's start with irradiation and reinforcement. This irradiation, what mean it? Irradiation, that means transfer of energy or overflow of energy. Reinforcement, that means to strengthen by addition or make something like stronger, that means a reinforcement. So proper applied resistance results in irradiation and resistance. So irradiation, that means we define irradiation as spread of response to stimulus. Reinforcement, that means defined as to strengthen by fresh addition or make stronger. The therapist directs the reinforcement of weaker muscles by the amount of resistance given to the stronger muscles. Irradiation to the dorsiflexion, you can see in the picture the irradiation to the dorsiflexion and inversion with leg pattern, flexion, adduction, external rotation. We can discuss the simple example of irradiation when you open a jam door, and when you open a fresh door or without any jam your door. So without jam door, it will be easy for you to open the door without just by using your wrist muscles or your hand muscles. But if it is jam, then you have to use your hand muscles. With that, you are using your shoulder girdle muscles, even you are using your shoulder girdle trunk plus contralateral muscles, contralateral lean muscles if you are using in that. Third procedure is manual contact. Therapist grip stimulates the patient's skin receptors and other pressure receptors. Means whenever we touch or we manually contact the patient, that will stimulate the skin receptors and it will provide, or when you touch or when you grip by lumbricals grip, it will create a pressures on muscles and it will stimulate the pressures receptors also. So this contact gives the patient information about the proper direction of motion. The therapist's hand should be placed to apply the pressure opposite the direction of motion. To control movement and resist rotation, the therapist uses a lumbrical grip. The lumbrical grip gives the therapist good control of the three-dimensional motion without causing the patient pain due to squeezing or putting too much pressures on the body part. Next, fourth procedure is body position and body mechanics. Johnson and Saliba observed that the more effective control of the patient's motions come when the therapist was in line of the desired motion. As the therapist shifted position, the direction of the resistance change and the patient's movement change with it. That means you should be, or therapist should be in aligned with the resistance or aligned with the motions of a patient. So where you so this body mechanics or body positions teach us or therapist positions in with while applying the PNF techniques. Next is verbal stimulation or command. The verbal command tells the patient what to do, when to do it. The therapist must always bear in mind that the command is given to the patient, not to the body part being treated. Preparatory instruction need to be clear and concise without unnecessary words, and there may be combined with passive motion to teach the desired motion. Timing of the command is also very important when using stretch reflex. The initial command should come immediately before the stretch reflex to coordinate the patient's conscious effort with the reflex response. The command is divided in three parts: preparation, action, and correction. Preparation, that means readies the patient for action. Action, that means tells the patient to start the action. Correction, that means that tells the patient how to correct and modify the action. So this verbal stimulation or in command we can learn if we want or therapists want muscle contraction, then stronger command is needed. Means stronger command should be applied during the muscle contraction, and softer tone should be used for relaxation. That means if we louder command will stimulate or it will create the further muscle contraction, and softer tone will provide the relaxation to the patients. So today we have discussed about the basic procedures of facilitation, in that irradiation and reinforcement, manual contact, body positions and body mechanics, and verbal command. So thank you friends.